Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Vanessa Gamblin, the Director of Indigenous Relations, and Anastasia Zifrick, the Director of Development, both from Main Street Project, a community health center located in Winnipeg, Manitoba. Through the Systems Navigation Access and Partnership SNAP project, these CHCs are increasing efforts to improve health and social systems navigation access, to strengthen Canada's healthcare landscape, and eliminate health disparities while improving population health outcomes. How are you both doing today?
Fantastic. Excited to be here.
Yeah, thanks for having us.
Of course. Thank you both for being here. I did mention briefly before we started this call, I have had the pleasure of connecting with Main Street Project in the past. On our YouTube in the Support CHCs column, there is a video where we uncover a little bit about Main Street Project, but I would like to ask whichever one of you would like to go first to tell us a little bit more about Main Street Project for those who do not know, the community that you serve, and the programs that you guys offer over there.
Go ahead, Anna.
Sure. Main Street Project is a community health center, obviously. We've been around since 1972, so we're well into 5 decades of serving Winnipeg's most vulnerable people. So all the marginalized citizens of Winnipeg that need access to housing, support with substance use. We have a robust outreach program that is citywide, and we operate one of the city's biggest shelters.
Great, thank you. Vanessa, did you have anything that you wanted to add?
A lot of the people that are traveling through the access points of Main Street Project are also coming from all areas of Manitoba. Sometimes we see an extension all the way through Canada, national cross borders. So we're seeing that they're traveling from all over. So we have a lot of great collaborators and play with us as well.
Amazing. Of course, the one of the reasons we're doing this podcast is because of the SNAP project, which you were able to receive funding for. And so, I mean, they are wrapping up very soon, but I think they're still underway. If you would be able to tell us a bit about what your SNAP project is, what you've been able to achieve so far, and what kind of impact your project is having. Vanessa, if you'd like to go first.
Sure. What we've done is we've implemented a space here at Main Street Project enhance cultural, spiritual practices for Indigenous people in Canada, and those accessing all services at Main Street Project. So a lot of the times we saw that the programs and operations for Indigenous people come from a physical, mental, sometimes emotional practices, and the spiritual context was missing. And for Indigenous people, it's one of the highest importance pieces for us. And so we have applied that within the work everywhere in all the departments. So we implemented the role called a SCABE, which is an Indigenous helper. They'll have spiritual teachings, knowledge, gifts of only the knowledge that they do have. And when they were working with specific people from departments such as the detox department or withdrawal management, from the shelter to the casework to the housing to the IPDA, which is Intoxicated Person Detentions Act unit, we were seeing that we would need a little bit more of that love from that context. So that's what we did. We implemented through a SNAP project that would include people being able to attend ceremonies of Indigenous practices, so sweat lodges, sun dances, all kinds of healing ceremonies, and go on for a long time. And then you'd be invited into spaces of knowledge, such as language keepers, medicine keepers, going into various spaces. And so that would breed into their healing journeys. And yeah, we took it from another stance. And so we've been implementing that now for quite some time.
That's amazing. And am I correct in that you're also helping members of the Indigenous community like return home to their specific communities?
Yes, and so we saw that the biggest part of the SNAP was to ensure that they're able to get home. We always see the barriers of reasons why, and a lot of the reasons why was all various ones, but because of the lack of spiritual supports care, so we saw that by able to incorporate this component, people were able to get home a little bit more successfully. They felt like they knew themselves a little bit more. They can take that knowledge, whatever they were gifted or already had, a lot actually had many, and they would travel home more with the success of their own healing. And so once they were home, may that be a community far away from 12 hours, some isolated on places where you fly in, they were going home and doing a fantastic job. Some would want to stay in the city, but the initial practices ensure that they were going home in that good way with their own bundles.
Amazing. Anastasia, did you have anything you wanted to add before I continue on?
No, just that this kind of was born out of our strategic planning that we were doing, which started in 2021, to look at, our goals to reduce the amount of time that someone is using our services, particularly shelter. The longer someone kind of gets stuck in a system, the harder it is for them to reconnect with where, safe places that they need to be, including Indigenous communities. And at the time we were like, what does that look like? How can we do that? We're barely resourced properly to do our regular work. How are we going to actually, help folks make those connections and go back home being healthy? And Vanessa came on board shortly after, and yeah, we fleshed out this plan, but it really required a lot more than just giving someone a bus ticket. It was making sure that they're going back after participating in the appropriate ceremonies and healing that only Indigenous people can provide.
Absolutely. And I'm curious, so obviously the portion of your staff project of helping members of the Indigenous community return to their home communities is something that we believe might be the first of its kind. It's very, very unique. And I just wanted to flesh out a little bit more maybe about why it was so important to give these people the tools that they needed to go back and to find their safe homes, safe communities.
A big part of this is it's a historical practice. It's hard to explain quickly and softly, but we sit in spaces of elders, knowledge keepers, spiritual guides that have been going on for generations. The Indigenous people is very much a verbal language share. We don't write things much down. And the biggest thing is for us to protect Mother Earth and always to be a part of her, and to participate in the ceremonies about walking out in the world in a good way, we call it. Walking with lots of love, walking with lots of kindness. And so the elders would always ensure that that's our job, is to always return to your healing spaces. So if you're born in, I'll say Puckatawagan is one of the communities. If you're born in Puckatawagan and you had to leave and come into the city for whatever reasons, and the goal is to go back home, we always say that your healing of the water, your healing of the earth, the healing of the fire, all of those components, the winds, that when you're born, that's what you know. When you're coming out of your mom's womb and the ceremonies you heard in Puckatawagan opposed to the alarms of city of Winnipeg, your healing becomes to a reduction level and you kind of lose your language of your ceremony. And so it's very critical that they were returning back to their own communities. May it be enforced through the old treaties and everything, but they know that land. And so the other part is the animals that are there, the fish that are there, the insects, anything was to embody how to wake up every day. We wake up with the grandfather sun and we go to bed with grandmother moon, and all those animals there is your responsibility for that space. So then the people from Broken Head First Nation around here, they too have their own space. When you go to Cross Lake, Manitoba, the same thing. And then all of a sudden we have somebody from Saskatchewan or from Quebec or Mittissini or somewhere, wherever we're moving and traveling around. It's very critical that they go back, because we say that your healing of yourself is only capable of healing when you have your family and your friends and your ceremonies around you. And we'll call it your home fires a lot of the time. So it's kind of like, when you go into your grandma's house, your auntie's house, and you just feel, even if they're bossing us around. But that sacredness of healing is simplistic, it's valuable. And the more that people are there in their healing, and if they know the knowledge that they need to have, because a lot of it's been taken away due to the colonial impacts, we're trying to invest that time to see that they can go home with their bundles, we'll call it. And that's due to the elders reminding us every day. So it may the elder be from Puckatawagan or from the States or to the Maori community far, far away from us, they're all telling us to do the same thing. So that's what we're still continue to achieve.
That's amazing. That's wonderful. Anastasia, did you want to add anything?
Just that I love the way Vanessa articulates that. It's that for non-Indigenous people to try to understand that there's to complete many other dimensions to Indigenous homelessness than your typical colonial homelessness, which is just not having a roof over your head, right? It's not just lacking a structure, it's being disconnected from the land, it's being, historic displacement of Indigenous people for, generations, the disconnect from your spirit, the way that Vanessa was describing. This SNAP project was kind of touching on trying to address one of those, or more than one, but just those different dimensions that are the only impact Indigenous people.
Absolutely. And to that point, I'm curious, within all of the facets that were going on within the project, did you experience any challenges trying to implement these various like SNAP project tools, and how are they addressed if you had challenges?
Yeah, we had lots of challenges. When you work within a system that is designed from the colonial mindset or from a structure that is about economics and everything that it is, a lot of people don't see the value of taking people around a fire and sitting there and doing whatever the ceremony would be of that. And then also when you work within a context and people have had a huge timeline of Canada saying this is what's best for individuals healing, may that be the old structures of psychosocial training, all kinds of different therapies, all kinds of things, and telling and these theories that work, but for generations we've seen that it doesn't work for Indigenous people. So people that have been working in a system, may it be recent to long term, their brains are impacted by the colonial structures of this is what's supposed to work for everybody. Although what's happened is it was taking a lot of time for us to enhance the space of Main Street Project to travel through that. So we talk about this still, that we had to walk through a space of 50 years of this is how we did things with the practice of the justice system, the health system, the child welfare system, all the systems. And with that, we had to walk through truth. We really had to see what are we doing great in this and how did we actually harm Indigenous people? And what did we do that was, not so great? And so we really walked that out, especially from a leadership context, from a board context. And then we really moved through that in every department with all our employees, and to really see where we all sit with that. And that's okay. Doesn't matter where everybody is. It's okay. We're going to walk through this in a good way. And so it was, sometimes you'd walk directly right into the face of racism, right up into the face. Statements were coming out, not intentional to be harmful, but maybe that was their own knowledge. So in a Spaces Main Street Project, we said, Kate, well, we got a lot of work to roll through. So we just kept walking through truth. So we talk about the TRC a lot, the Truth and Reconciliation Calls to Action. And with that, we do our best not to formulate saying we're in reconciliation yet. We just really want to walk out truth. So a lot of challenges and still sometimes we're not so much there. We've been at 3 years now, and some of those SNAP project is shorter, of course, but we have a lot of that to do. And so we're moving through some of the reconciliation now.
Absolutely. Anastasia, did you want to add any other challenges or anything else that was addressed through the SNAP project?
No, I think Vanessa covered it.
Perfect.
I do think though there's other parts of it though I did miss, is like when we were doing some of this too, working with SNAP was actually very easy actually with the funding parts. Like when we're looking at the reporting structures of trying to report back, SNAP was very engaged. Well, we didn't get a lot of challenges on like how many people did you smudge, how many drums did you make, how many ceremonies do you attend. So that was one thing that alleviated a lot of the good work. And then so when we were trying to work with the other partners, some of the partners would want those while we were still trying to provide the SNAP project outcomes.
Right, of course. Well, I mean, I'm sure Aisha and Ewa will be happy to hear that it wasn't too difficult to be achieved. And I guess that aside, what are some of the successes that were encountered through this project and all? I mean, like if there's any we've had people say testimonial in the past, but also, if there's anything you'd like to share in terms of, the great work that was able to be done.
Oh, it never ends actually. Long story is that we know when we do the work from like a leadership level, we have to really walk through these spaces of colonial settings, and the most simplistic beauties of it is I get to see all the other parts, but today was even an easy one. I walked into the Circle Life Thunderbird house and I saw women who are in their choices of detoxing or withdrawal management, and they're at their stages where they want to be. And they're all doing a ceremony together with a cookum, a granny. And they were laughing and singing and joking around and telling their stories of, oh, my granny used to do this, and living in those moments. So I got to see a glimpse of it again today, but we have story after story now. Like people will have successes such as they really move all the way through their detox from 0 to 14 days because the SCABE is present, because Escabe does the medicine with them, because Escabe does the drumming with them, because of what we've implemented. And all through it from the beginning, Escabe will say, what's your spirit name? We're like, oh, I didn't know what that means. They'll say, oh, what community are you from? Nobody's asked me that before usually. Oh, who's your family members? And so that delivers an immense outcome just in itself, because it gives them an opportunity to say, Kate, I'm going to go home and I'm going to stay here the 14 days. And we've had volumes of successes of people sticking it all the way through. We have lots going home. We have ones that said they were outside of their employment and they quit because of drugs or whatever else, or homelessness or whatever's going on, lost their families. We have reconciliations of families. We have people back at work. I have one who was a pilot and he's just so cool. He says, when I come there, I'm going to come visit. We have all kinds of stories. But one of the biggest ones that I always think are fantastic is by implementing the SNAP and the ability to implement that. Okay, how are we going to get you home? Some would say that this is home. Actually, the city of Winnipeg can only be home, and therefore this would be their community. So we derive that. What does that look like for you? What does that community look like? And they would entice us with all kinds of variations of what that looks like. So one wanted to stay through detox. We were out with the crew, I call crews. They wanted to learn about Sundance practices. We all went out onto the land with a Sundance keeper, the Sundance chiefs, whatever. There's all kinds of teachings of this, and just to get the land ready. And it was a long time. You have to do lots of work. It's laboring. So he really wanted to be there. And at one point, he's coming to me and says, "Vanessa, I want to stay. I want to pledge." I was like, "What?" And I was like, "How many days you been in?" He goes, "4 days." I'm like, "Man, it's like that's only 4 days. Like, are you sure?" And he's like, "Yeah." And I was like, "Well, 1 second." So I had to go find the Sundance chief, and I told him what's going on, told him who it was and what we knew about him. He had all kinds of medications that he needed for his own body, and Detox was providing that within our program spaces. So him and the Sundance chief sat down. They reviewed what was necessary. Sundance chief came and bossed me around, I'll call it, because they're our elders. And I was like, okay. He says he's staying. He's pledging. I'm like, oh. So from there, all of us had to work together to get all the necessary items. So all of us did what we needed to do to get him to make sure he could stay there. And then he conducted and attended to his Sundance, and that's 4 days of fasting and healing and everything. And he went without his medications for all kinds of stuff because the medicine people that were there, the language keepers, the healers were there, and they took care of him. And that man is still sober to this day. And every day he shows up here, almost every day, on his own. He shows up at the Circle Life Thunderbird house and he wants to clean up, or he wants to do this, he wants to fix that. And he tells people around here, don't mess around. This is my home, kind of thing. And to him, this is his space. And now he also stays within one of our housing units. And he really is, as many, that's just a small, tiny story. But when people have the ability to sit in their own healing, and nobody's ever the same. Is as soon as they bang on their own drum or make their first rattle or sit in a lodge, they go through their own spiritual journey, and they attach themselves into their ceremony, their communities. And some find their grannies and grandpas. We found family members that they never knew, all kinds of stuff. It's amazing. It's fantastic.
That sounds so beautiful. That's absolutely amazing. That's wonderful. Anastasia, did you have anything to add? I feel like that was that's perfect.
No, I definitely don't. That was great.
Right. I'm like, the podcast is done now. That was the end. Thank you. No, I will ask. I mean, I guess a key question to ask, of course, is if Main Street Project intends to sustain this work once the project wraps up, and if there is a hope to continue to do this, because obviously it sounds like it's absolutely paramount.
Anna, you want to go ahead?
Sure. I mean, you can jump into absolutely. We'll continue doing it. I feel like one of the goals of this, it was more like a pilot project, right? To kind of see if we were to do something more robust, what would that look like? We would have to, it'd be great if we could hire a person to do this full time, and maybe that would be in the cards, but it is built into somebody's role here now permanently. So, that's a huge success. And it was, yeah, it was just really nice to pilot something and be able to do, have the time, have someone not doing enough of the side of their desk. So, committing for the first part for the person to do all the research about what's happening across the country to see if there's best practices or somebody else is doing this, how are they doing it, to learn that, like, no, it's just us. And yeah, to be able to have someone permanently in place who has the skills and, slowly evolved over time, but it's definitely here to stay.
Mhm.
Good.
We
Glad to hear.
we really went into like even the deeper dive of, we pinched through all our budgets. We reassessed how do we ensure that we could influence every department to have a SCABE, because we started finding that people would be in one space. It was primarily in the shelter at the beginning, and they'd be in another department saying, well, do you have a SCABE? I heard you guys have a SCABE in the shelter. Like, can we have one of those? And so as we moved through this, it was something that we really looked at, like we really need to sustain. And now it's just always sustaining now the budgets, of course. How do we resource this?
Absolutely. And of course, my segue to my favorite final question. What would increased federal or provincial investment allow Main Street Project to achieve, and how would it impact, pardon me, your SNAP project? But of course, how would that investment impact your CHC at all positively? Anastasia?
Sure. Well, I mean, our whole mission is to connect, to eliminate homelessness, to connect people back to their community, wherever that may be. So that it's, continuing this work is a continuation of our mission. We can help more people.
Absolutely. Vanessa, what about you? What do you think any increased investment would allow for Main Street Project to achieve, or to achieve further with the SNAP project?
It's hard for me to put this in a short term. Main Street Project is a core hub in the city of Winnipeg and the province of Manitoba that has the largest capacity of Indigenous people accessing shelters and all the resources we do, and especially like the IPTA practices. And unfortunately, because of the colonial practices, people are always at harm in all these other spaces. So we're a melting pot of that, if we want to call it. And by the work that we're able to put through with the SNAP project and all the rest that we're implementing, I say this kindly, is that we're relieving the pressures of the health sector. We're relieving the pressures of the justice, the child welfare. We're actually picking up their shitty messes, I'd say. And we're kind of like, oh, like some people would say to me, Vanessa, the first time I've ever been in a sweat lodge was actually in jail. And they grew up in child welfare from the age they were 3, and now they're 46. And so we're really at a point where, by implementing something at a homeless shelter, which should not have to occur, we should not have to wait for any human being to find their spiritual contacts in Canada at a homeless shelter after they've been through the generations and the impacts of the systems. So I say we're really driving something that has been missing for quite some time in all spaces. So when you go into the health sector, when do you actually hear them talk about spiritual care? It's more about the physical care, and they only do their space. But we're seeing more and more that within the sectors that are working with us, they're like, oh, how do we do that? So we're actually also influencing those sectors, like Winnipeg Regional Health Authority now. Other shelters have said they're putting SCABEs into their departments. Other agencies that were just doing housing first practices are doing SCABEs now. Other people are saying, we're going to do lodges too. How do we do this? Other agencies, the Indigenous agencies, have always been doing this one way or another, but the homeless sector has not. So when you look at through Canada, there is no such thing. We do see that eventually this will be, and then also this has derived that we've implemented an MMIWG, also SCABE. So they're working with ladies that you'd see at the forefront of the shelter to say, hey, you're a risk. What's your spirit name? Where community are you from? And what are you doing here? And who's your family members? Then from there, we entice them to join back in, and they're mitigated. And now we don't have to worry about the Winnipeg police and CSIS and all that jazz. and Canada's not seeing what we're doing. And the funders, when you think about this, reality is the people that are sitting in the spaces, accessing houseless spaces and the really unhealthy spaces, are only here because of the failures of the systems, unfortunately. And so I'd say we're doing grandiose, great work, and I think the federal funding and all kinds of funding should do this in every shelter across Canada, actually.
Absolutely. I completely agree. Thank you both so much for this wonderful podcast and all this wonderful information, the amazing work you've been able to do with the SNAP project. It's wonderful to hear that you're able to continue that work and sustain it in some capacity. And I do hope that there are more peer navigators, whatever that looks like, for every group of people that need it across the country at our CHCs and beyond. I mean, it would be great to walk into a hospital, like a general, just a plain Jane hospital, and have someone look at someone else and ask, what they need and how they can benefit them through whatever procedures they're going through. Um, and of course, if anyone wanted to learn more about Main Street Project, about this SNAP project, or any of the work that you are doing, where should they go?
They can go to our website, mainstreetproject.ca, and then we've got a good presence on all the social media channels. So you just search for us there.
You absolutely do. I follow your Twitter and I share it often. And I am a big fan of Main Street Project
Oh,
social media.
thank you.
I thank you both so much for participating in this podcast. It's absolutely wonderful chatting with you. And I hope you both have a wonderful day.
Yeah, you too. Appreciate this. Thanks, Hillary.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.